Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over how to master a patient's chart. Now, as a nursing student or a new nurse, the very first time you are ever exposed to a patient's chart, you're going to think, oh wow, how am I ever going to master this material? Because charts contain a lot of information about a patient. And whenever you're new, you don't know what's important compared to this. You don't know what you need to know to help you do your job. So in this video, I want to help you with those things. I want to talk about what's the most important information in a chart. I'm also going to talk about ways that you can master it, help you to get organized and to learn how to filter out, is this important? Is this not important? Should I look here? Should I look there? And how to actually organize all this information for reference. Okay, first let's talk about charting. Charts, like I said, contain lots of information. I remember whenever I was a nursing student and we had to go to clinicals to do a care plan on a patient. In order to do a care plan, you have to look through the chart. And I remember looking through the chart, and this was before charting was online. Online charting has made things a lot easier, which I'll go into here in a second. But the chart was just in a notebook. And I remember thinking, how in the world am I going to know what to look for to develop my care plan? And whenever I become a nurse, how am I going to be able to pick out the most important information to provide care to this patient? But it does come to you, and in this video I want to give you some tips on how to do that. Okay, first let's talk about charting. Every system at a hospital is set up differently. Every hospital is going to use a different program. They're going to call things differently. So the key is you want to get familiar with the place that you're working with, what type of stuff they use. Because one place I worked, they had online charting. Most of it was online, but some of it was still in a paper chart. So you want to make sure that you're familiarizing yourself with that. Now, online charting is great because one thing that I love about it is that I can look at patients' previous hospital stays. And if they were there 5 years ago, I can see why they were there, if they had a heart cath, what their heart cath showed, everything like that. And before then, it was just in this paper chart and you would have to call medical records and there would be a delay and it really hindered patient care. So online charting is absolutely awesome. So first, let's go over how to organize this. Okay, very first thing that I really recommend whenever you are a nursing student or a new nurse is that you get or you make your own report sheet template. And let me show you a sample one. On my website, RegisteredNurseRN.com, a link should pop up. You can go and download some free report sheets, and right here I have some report sheet templates. You could double side print this and get 4 patients on it. And it literally guides you with everything that you need to learn in a report, because that's where you're going to learn a lot about in your patient than whenever you're going to be looking at the chart, because you're going to look at the chart, but you're also going to learn a lot in report. So I really recommend you get one of these or develop your own. You can look at mine and develop your own. And what these report sheet templates do, they allow you to have a quick reference for whenever a doctor asks you a question, because you're going to have 5 or 6 patients sometimes, depending on what type of unit you work. And the doctor may ask you a question and you have 5 patients I don't know. So you could bust out your report sheet template and see where that information is and tell them, instead of having to find the chart and look through it and tell them the answer. Next, it helps you keep your patients separated, because like I said, you can have a lot of patients and they can have similar things going on, and it can just help you with that. And also, it's great to help you keep track of tasks, like if you have to give medications, you have a dressing change coming up, anything like that, and just to jot notes on. But remember, at the end of your shift, every shift, you shred that nursing report sheet template, because you don't want to store it in your locker or take it home because it's a HIPAA violation. Okay, here are some ways to master it, and then I want to go over the important areas in the chart that you need to familiarize yourself with and go over so you can master a chart. Okay, ways to master it. During your clinical time as a nursing student or your orientation period, you need to take advantage of that. This is time where you can literally just get in a cubby somewhere away from people, go sign in to the computer charting and just select a patient that you're assigned to and look through all this important information and see what's important, what's not important. And also, whenever you're with your clinical instructor, see what he or she is looking at, what they are most likely to use, and things where they grab their information. Next, Learn what's vital to know, which we'll go over here in a second, and learn how to ask the right questions in report, because sometimes you're going to have such a busy day that you're not going to have time as a nurse to sit down and to just look through that chart from top to bottom. So you really need to know those important questions asked in your report. And I made a whole video on how to give report questions to ask, and you can check that video out as well. A link should pop up so you can watch that. And next, like I said at the beginning of the video, learn your job systems charting. A lot of places will offer a class, or they require a class for new nurses to take on how to clinically documentate, and they go through all the sections of the documentation and show you how to do that. So if that is available for you, take that, because it's an excellent resource. Now, let's go over the important stuff. Okay, I have divided, whenever you have a chart, you have little tabs usually that's divided into flow sheets, doctor's orders, and you just click those and it'll take you everywhere you got to go. Or if you're still using paper charts in a notebook, have little tabs that'll say H&P, flow sheets, things like that. Some of them are called different names, but they're generally the same thing. Now, I've divided these into two sections. This part of the chart is what's going to help you learn your patient. So you'll know what your patient's history is, who this patient is, why they're there, and can help you learn that part. This part of the chart helps you do your job as a nurse and helps you keep on track with your nursing tasks. So first, let's go over the sections that help you learn your patient. Whenever you're looking through your chart, you want to make sure that you're paying attention to the H&P, which is called the history and physical section. This is so important, and it's such a great little section. Before I became a nurse, I didn't really know about this section, so I was looking everywhere to try to find history information on a patient or their allergies and things like that, and all these different sections. But the H&P literally has it exactly there. And on this section, it's completed by the doctor. This is where your consults will come in, and this is where your admitting physician, and it will tell you what's going on with that patient, what they presented with, their signs and symptoms, everything like that. It will tell you their history, their whole health history, their surgical history, their allergies, their current medications, and this is one of the most important things, and what the doctor plans on doing, their whole plan of care, what regimens are going to be started, who they're going to consult, what procedures they're going to order. It's excellent. So definitely pay attention to that part. Next, the diagnostic testing results. A lot of times patients are ordered chest x-rays, echocardiograms, stress tests, everything like that. And in this section, you can go and see if the results are back, and if so, what they said. And this helps you understand, okay, this patient was admitted with pneumonia. Let's go see what that chest x-ray showed, because we've started them on IV antibiotics, and let's see if they're getting better. And a lot of patients want to know, hey, what did my stress test show? So you can tell them. So very important section. Next section that you want to pay a lot of attention to is your lab work section. All patients come to the hospital and everyone gets blood drawn. And this lab work section will tell you, hey, how's their hemoglobin, how's their electrolytes, and this is going to help you as the nurse taking care of the patient. Because say you're going to be giving some IV Lasix, and we know that Lasix wastes potassium. So if your AM labs came back and your potassium level was only 2, and the patient's ordered a 10 o'clock dose of IV Lasix, like 60 milligrams, you probably want to hold off giving that Lasix until you call the doctor and let them know that the potassium level was only 2, because you're going to bottom out that potassium if they didn't have any ordered. So lab work is so important. And plus, in the morning, whenever your labs start coming off on that section, you'll want to call any abnormal results, if it was abnormal the previous day or anything like that. So that's really going to help you learn who your patient is and what's going on with them. Now let's cover the section on the sections of the chart that help you do your job. Okay, vital signs and flow sheets. This right here is going to tell you, you can look back at vital signs. Some software programs that your hospital use will create beautiful graphs to show you how the temperatures have been, have they been spiking, how blood pressures have been. And if you're getting your morning vitals, you can say, well, the blood pressure was just 100/60. Is that normal for that patient? You can go back and see if that was normal or not. So that's very important. Flow sheets for IVs. Next time an IV needs to be changed. A central line dressing needs to be changed. Peg tube dressing, wound care, very important. You want to get familiar with all your flow sheets. And nursing notes. This is where your care plans are updated. Do you need to update the care plan? Is your patient having a new problem going on that you need to add a nursing diagnosis for, that you guys need to concentrate on for the day? Nursing notes, you can look at previous shifts and see how this patient has been progressing. All of a sudden your patient becomes disoriented, and is this normal for the patient because they have a history of dementia, but did this happen the same time yesterday to the other day shift nurse? So you can get in those nursing notes and look at that. Very important. And doctor's orders. You're going to spend a lot of time on this section of your chart because a lot of times you may not see the doctor rounding because they sneak in. You can look at those orders, see if they've ordered anything new, see what your future orders are so you can be prepared for that. That's a big section that's really going to drive what you're doing as a nurse, and new medications that come in as well will be under this section. And then next, the medication system. Some places use a completely different program than their documentation program. I know some places use a program called MAC, M-A-K, and it's just your medication administration system, and it tells you every time a medication's due, and that's a really good place to be looking because how many medications you're giving today is really going to drive how your day goes. So that is some ways on how to master a chart. So overall, in conclusion, I really recommend that if you're a nursing student, new nurse, that you get in there, you look, you practice, you get your report sheet, you jot down what's important, you see what other nurses are always looking at, watch your preceptor, and just practice and practice. And I promise, over time, you're going to learn this information and you're going to master it, and you're going to think, oh wow, I can't believe I even had trouble with it, because over time it just becomes second nature. So thank you so much for watching, and please check out my other YouTube videos, and please subscribe to this YouTube channel.